Ladies and gentlemen, once again, you are most welcome to the online pregnancy school. We thank you for being with us, for those who have been sending us messages, sharing with us how these programs have been benefiting them. We say thank you. We are grateful to God that by his mercies and by his grace, we are able to discuss topics that are beneficial to people. If today is the first day you are joining us, this is the online pregnancy school, where we talk about the family. And I invite you to share the link with others. And if you haven't done that, kindly go ahead and hit the subscribe button. And remember to turn on the notification bell. Also, please go back to the previous sessions that we have had. Look through them. Pick a topic that you have questions on. Watch that video. And if you have any comments, please share them with us. Or if you want us to talk about anything because you did not understand so well, please also share that with us in the comment section. My name is Dr. Linda Vanutu, and it is always a pleasure to come your way with the online pregnancy school. Today, we have another important topic that we are going to discuss. It's a topic that a lot of women have heard about. Some of them have experienced it, and others want to know more about what the whole thing is about. And that is what we're going to discuss today. It is about polycystic ovarian syndrome. And I'm going to do this with Dr. Benedict Afari. Dr. Afari has been with us in previous sessions where we have discussed other topics because he's an obstetrician gynecologist. And therefore, he's the right person to tell us about this syndrome, which many people have heard about, others may not have heard about them. And some have questions because of some experiences that they have had. Today, we have an opportunity to know more about it. And therefore, please join us, take a pen and a paper, and call that friend. You could even be a male, you never know. You get married and your wife goes to the hospital and they say that she has this. Then you start wondering, what is this? So please join us and share with friends and family. Doc, you are welcome to today's session.
Thank you very much, Director.
How are you?
I'm fine, thank you. And you?
By his grace, I'm very well. I'm doing very well. Yes. Yeah. So today we're going to talk about polycystic ovarian syndrome, a big name. What is it?
Okay, so polycystic ovarian syndrome, we call it PCOX for short. It's an inherited medical condition that affects women. Because this one doesn't affect men. It only affects women and women in the reproductive age group. So what it means is that usually before you have your menses or before puberty and after menopause, we don't talk about polycystic ovarian syndrome. And as the name suggests, it's a combination of different symptoms and signs. That is why it is a syndrome. And it's not just one single entity disease. And because it's a syndrome, there are classifications. So you may need some of the features or the signs for us to be able to say that you have polycystic ovarian syndrome or not. So there's a classification that we use. And there are three main cardinal features of it. So if you have about two of the three cardinal features, we can conclude that you have polycystic ovarian syndrome. So usually the first is anovulation or lack of ovulation.
Okay.
Then we also have high levels of the male hormones called androgens. Okay. Then we also have the features that can happen to the ovaries. So that's why even the disease is called polycystic ovarian syndrome. So you have some cysts on the ovaries. So these are the three cardinal features. But if you have any two of these three, we can say you have polycystic ovarian syndrome. And most of the time, we found out that there are some people that we can diagnose. A cyst is a fluid-filled cavity in the body. So if you take the ovary, for example, the one that produces the eggs that make the pregnant woman gets pregnant, when there's a collection of fluid in it, especially after ovulation, you realize that where the eggs got off from the ovary, those cavities that are created, if you have fluid filling it, we call it a cyst. And we have different cysts. So for this polycystic ovarian syndrome, the cyst that we talk about is different from the normal ovarian cyst. This one, it is said that it is arranged around the ovary. So it is found at the periphery of the ovary. And usually we count a certain number and volume for us to be able to determine whether you have the polycystic ovarian syndrome or not. Because women can have all type of cysts. You can have different cysts and multiple cysts in the ovary. But for we to say that you have polycystic ovarian syndrome, there is a certain number of the cysts and it should be arranged periphery and they should have a certain size and volume. Then we say that you have polycystic ovarian syndrome. So like I said, if you have any of them, we say you have, usually will present with what? Either you not having your menses on a regular basis, we call it oligomenorrhea or amenorrhea. So sometimes you may not be having your menses on regular basis. Sometimes 2 months, 3 months, your menses has not shown up. Or sometimes for some time, anovulation, that is your inability to ovulate or produce eggs for you to get pregnant, can manifest as what? Menstrual irregularities. And this is one of the features that the women may present with. Then those who have the high levels of male hormones, the androgens, we call it hyperandrogenemia, they may also present with features such as acne, a lot of pimples. You see a woman, she has a lot of pimples on the face. Then you see a woman who has a lot of hair, facial hair, she has a lot of beard, mustache, hair on the chest. You see women like that. Then you also have, sometimes you can even see a woman who has a bald head. A woman can have a bald head, all because of the hyper levels of asbate is the features that we see on the ovaries. But we also realize that apart from these problems, your inability to ovulate, the high levels of male hormones can also give you other problems like insulin resistance. So sometimes we realize that some of these women may come up with diabetes. Then most often these women are also obese. Yes. So these are, then they can also have some cardiovascular problems like hyperlipidemia. So it's a whole spectrum of problems that a woman having polycystic ovarian syndrome can have.
Wow. Doc, so if you are a woman and you find that you have hairs growing on you have beard and you have hairs on the chest, should you go to the hospital for screening?
Yes. It can actually be the first time that we diagnose you or having polycystic ovarian syndrome or disease. Sometimes we use the word disease for it, yes.
Oh, okay. Ladies and gentlemen, so if you are watching us, listening to us, and you are a woman, you find that you have some of these symptoms that doctor has described, where your menses are irregular, you have beard, you have hair on the chest, and all this. Please don't just stay at home, because you might not know whether this is PCOS that we are dealing with, unless you go to the hospital for them to check. Doc, let's just look at the age. Did you say that for a young girl, it will not be seen, and those who have menopause, they don't also have it? Which age group is affected?
in the reproductive age group. You know, in Ghana, our reproductive age group is between 15 to 49. Yes. But we know that some women or some young girls can have their menses early, or their puberty can be early. Yes. So sometimes a young lady may have primary amenorrhea. What it means that she's never had her menses and she's gone far a bit of years. So that can actually be one of the presentation of PCOS, or the polycystic ovarian syndrome we are talking about. Then of course, because it has to do, if you are in your menopausal stage or age group or period, then of course, PCOS will not affect you.
Okay. Doc, just for the benefit of our listeners, at what age should a girl start menstruating? So that if a parent sees that her child is above a certain age, she would be concerned and send this child to the hospital for assessment. What is the age that girls start menstruating?
Yes. So currently, we realize that the age of menses, or the age at menstruation or puberty, has actually come down. So for the women, for the young girls, you are having them between the ages of 12 to 14. Most of them are starting between the ages of 12 to 14. There are even some that may even start around 10 or even 8, but that one is precocious puberty. But averagely, between 12 and 14, most of them will start. And any girl that by age 16, between 16 and 18, you've not menstruated yet, it could be a problem. So averagely for the woman, increasingly between 12 and 14. But after 16, going and still there's no menstruation, it is a cause for concern. The boys, on the other hand, usually reach puberty quite a bit late. So for the boys, sometime between 16 and 18, yes. But for the women, they reach earlier. So for that, between 12 and 14, it's okay. Then if they are going beyond 16 and there's no menses, then we need to look at it.
Yeah, that is very important. I've seen a young girl who was at home. She hadn't menstruated. In fact, she was even past 18. And they did not send her to the hospital. Every month she had some pain in the lower abdomen. And finally, when they realized that she was getting to 20 years and they hadn't seen any blood, they sent her to the hospital. And apparently she had an imperforate vagina. So there was no hole, even for the blood to come out. So it is very important that when a child is delivered, they do a proper examination. And as a mother, as a father, if your child, as doctor is telling us, by 16 years has not started menstruating, then please send this girl to the hospital for them to do an assessment. Ladies and gentlemen, if you have just joined us today, I'm talking to Dr. Benedict Afari, and we are talking about polycystic ovarian syndrome, or PCOS for short. And he's telling us what it is and what we should know so that we take action. Doc, please, let's continue. So what are the features? You have shared some of them with us. Are there any other things that will help to make a diagnosis? In other words, how is a diagnosis made?
So most of the time, women with PCOS or polycystic ovarian syndrome will actually present the first time to the clinic as a case of infertility. So a couple has been trying to get pregnant for a year and they are not getting pregnant, and they come as part of the workup, the assessment and everything. We realize that the woman has PCOS or polycystic ovarian syndrome. Apart from that, I have mentioned a lot of the symptoms. So usually these things should be a telltale sign to you to be able to know that, okay, what is happening to you is all right or not. And you see, it is an inherited condition, but there are times that it doesn't show up so early. So some people, it delays in showing up. Or just as you said, most of us may not actually pay so much attention to what is going on in terms of our development. So by the time maybe we realize it's gone a bit far and it has taken time for us to make the diagnosis, but It's usually about the menstrual irregularities, either you're having your menses or not, the time interval. Then if there's another symptom, is irregular or abnormal bleeding. Okay. So even though you may not have your menses, there are some that present with abnormal bleeding. Then one of the other issues is that those who have PCOS, so sometimes when they get pregnant, they may miscarry. Okay. So you may have a woman who is having current miscarriages, and it is because she has PCOS. Okay. Then some of these women may have preeclampsia when they get pregnant. So, a woman, she's always getting preeclampsia anytime she gets pregnant. So when we actually take a detailed history and assessment, we realize that she may be having PCOS all through the time. It's just that public has not been picked up. So there's a whole spectrum of symptoms that a woman with PCOS can get. And chief of them is the menstrual irregularities. Apart from that, those features that are brought on by excessive male hormones in the body are all ways you can check. Then another thing is that there are some women that may also present with galactorrhea. They are having milky discharge from the breast when they are not lactating. Okay. It's also one of the signs. So there are a whole lot of things that can give us an idea that this woman may be having polycystic ovarian syndrome.
Look, it's kind of, should I say, it's challenging that all these symptoms can happen when somebody has the PCOS. Now, should people be afraid? Is it something that can be treated? And if it can be treated, what is the success rate for that?
Okay, so people shouldn't be afraid. So the condition can be managed. I mean, we've managed successfully a lot of these women with PCOS, and they have gone ahead to get pregnant. Okay. And we've been able to also regularize their menses for them. So it's not something that they should be afraid of. They just have to make sure that they come to the hospital, then they will be sorted out. So that is the main thing. When you see it, you come, because it can be managed. There are a lot of women that have PCOS. You will not even know, because for some way, somehow, they've gotten pregnant, they've given birth, and the menses issues that happen, they are not so much bothered about it. So they don't even come to the hospital. But a few of them will come. And there are a lot of them out there. If you look at the epidemiology, in the States, you have about 4 to 12% of women having it, especially those in the reproductive age group. If you go to Europe, about 6 to 7. In Ghana, about 2 to 3 of the women we are managing as infertility have this PCOS that I'm talking about. So it's a condition that is there. Yes.
Ladies and gentlemen, do not be afraid. That is what we are hearing. Doctor has described a lot of the features of this PCOS. So what it means is that if you have any of them that he has mentioned, especially irregular bleeding, please, if you are a young woman within 15 to 49 years, within that age group, please just go to the hospital. We have obstetrician gynecologists. They will see you, they will assess, they will ask you some questions to make sure that if it is, then they can treat you. For those who are about to get married, I have done a session where I spoke about preparing for marriage and then preparing or planning for a pregnancy. One of the things you can do is to have yourself assessed, the woman and the man. And for the woman, if you have any symptom, please don't hide it. Likewise, the man, if you have any symptom, if you find that your periods are irregular, just share that with the medical person who is seeing you, because that will help to find out what is exactly going on and give you the best management for you to also have the best of your fertility. So that is very important for you. Ladies and gentlemen, if you haven't done that yet, please go ahead and hit the subscribe button and please turn on the notification bell. Also share with friends and family. This is something that you need to hear about, your friend also needs to hear about it so that all of us will be well informed and prepared to receive care. That is all we are doing, trying to share with you what you have to probably hear or you might have heard, but are not sure of some of the things you heard. So please go ahead and share with friends and family. Doc, so what investigations are usually conducted, and are these expensive? Can people do them? Are the investigations available in our part of the world or in other parts of the world where they are watching us from?
Okay, so yeah, the investigations can be done. And in most of the big cities and even the districts, you can do those investigations. So usually we start with the history and the examination. The history may give you a lot of the symptoms that we talked about. Mm-hmm. The examination may not really reveal much. Then we need to go to the labs and do it. Usually what we do is to conduct tests on the hormones. So, I already said that it has a lot of these anovulation and menstrual issues. So we need to look at the hormones, the male hormones, the female hormones. We do hormonal assay. We look at the levels. We do the ratios to be able to determine whether we have to do a scan. The best scan or the preferred scan is a transvaginal scan. But if you don't have a transvaginal probe, you could do just an abdominal scan, and you are looking at the ovaries if there are any changes and all that. I know that the PCOS condition can predispose you to other metabolic issues. So, for example, you have to do your blood sugar tests, and apart from that, you may have to do lipid test as well, lipid profile. Then, of course, other hormones such as prolactin and all that should also be done. So these are hormones that can be done just to know the levels and be able to put the condition into perspective. So these are the and any other thing, especially when some of the complications to set in, depending on the symptoms that the patient come with, we can do other investigations to be able to rule out certain medical condition. Because what you should find, what normally we find is that there are lots of other conditions that can mimic polycystic ovarian disease. So you can have a thyroid disease, for example. Some of the features that we have talked about may occur in thyroid condition, other endocrine conditions. So we may do some of those tests to be able to make sure that it is not some of those endocrine conditions, but it is PCOS that we are dealing with.
That is very, very gratifying, because the opportunity is taken to rule out, as we say, other conditions. And if in the process it is found that you have another condition, then of course you are open for treatment. And that is very good. So please, as you hear us and you have any of the symptoms that doctor has described, even if you are not sure, you think you might have, just go to the hospital and they will see you. Doctor works at the Ga East Hospital in Accra. So if you are somewhere you are not even sure, you can go to Ga East Hospital in Accra and look for Dr. Afari and say that, Doc, I heard you on YouTube or Facebook or wherever on Health TV, and you were talking about this condition, and I have something which I want you to check for me. He'll be very happy to do that. We want people to have the best of healthcare. So please do that. Doc, what about the treatment? Can it be managed?
Yes, it can be managed. So normally the management is symptomatic. What it means that depending on the symptoms that you have or the problems the condition is giving you, will manage it accordingly. So there are some broad things that we do. Most of the women with PCOS have obesity, are obese or overweight. So one of the treatment modalities is weight reduction. Weight reduction comes with lifestyle modifications in terms of your diet, exercise, and so on and so forth. So that really helps, because the exercise, if you're able to do exercise to reduce your weight, it can actually manifest in a lot of the symptoms that you're having going down. It can restore your menses, it can restore your good health, it can even help you to ovulate and all that. So weight reduction is one key management strategy that we use. That one, there's no money, there's no medicine. You're just trying to manage your weight. So weight management is important. Then we also have medications that we use to be able to correct your inability to have your mess. So if you have oligomenorrhea or you have amenorrhea, it can be managed. Then apart from that, those who want to get pregnant, we can do what we call ovulation induction for them. And it will help them to be able to produce eggs and get pregnant. So these are some of the things that we do. Right. There are some medications that are in the system. Some of them help, some of them don't help. But usually when you come, depending on what you are going through, we'll give you the medication or treatment that will help you. There are even some medications that we use to correct the insulin resistance that you have as part of the condition, the lipid problem that you have as part of the condition, or any other complications that is arising from this condition. We give you medications for that.
Oh, so the people should not be afraid, because as doctor has told us, depending on what you are presenting with, that's why he said it's symptomatic. Depending on what you are presenting with, they have the answer for you. So don't be afraid. Somebody was sharing with me that she's sure she will be put on hormones and the rest, so she was concerned. But for you listening to me and to doctor, please do not be afraid. It is better for you to offer yourself for assessment so that the right treatment can be given to you based on how you are presented. Doc, you know, there are so many people who have reached out to us with issues of infertility. We have had sessions on infertility in the man, infertility in the woman, and then both of them. And it's strange that some of them have the PCOS, others have other challenges. But one thing that I would beg of people is that when you go to the hospital and you are asked to go through lab tests and investigations and treatment, please adhere to them. You know, it's not so simple. We know that God helps us, but you also have to be part of the solution. So if you are asked to do a test, please do it. If you are given treatment, please follow the regimen so that you can go through successfully. But some people get tired. In the meantime, they want to have children. Somebody reached out about a year ago. She was asked to do some things. She did not do them. And then a year after, she's reached out again. And it's a whole year. By this time, by God's grace, she might have had her child, you know. So I want to use this opportunity to please tell you that if you go to the hospital, follow the treatment, follow the lab, do whatever you are asked to do, because that is why they are there anyway. So please do that. Doc, all that you've said makes me very happy that something can be done for somebody who has PCOS. So people should not be afraid. But let me ask this last question. Is it something that the woman did that brought this to her? Did she do anything wrong?
No, not at all. Okay. It's an inherited condition. So the woman has nothing, she's not done anything wrong. She's not committed any crime. Just like any of those conditions that we are born with. Probably maybe you will say that it is God that gave it to you. So we should go and ask God why he gave you a particular condition. But it's not that the woman has done anything wrong. Okay. And there's nothing like any witchcraft, superstitious belief and all that. These are medical conditions. I mean, once we exist in this world, there are medical conditions that sometimes the science is there, the treatments are there. So when you get it, you go to the right place and you will be treated. But I must also add that there are some complications of this condition. That is why it is important to pick them up early. Yeah. Because the PCOS is been linked with some cancers, especially endometrial cancer. And the reason is that for those who are not having their menses on regular basis, they may have endometrial hyperplasia that can predispose them to endometrial cancer. Okay. Even there's also a risk for ovarian cancer. Then the other thing is that there are also cardiovascular conditions that, because of this metabolic of developed type 2 diabetes, people can have hyperlipidemia, and this can give them heart conditions, stroke, myocardial infarction, and all that. Then obesity, we already know obesity is a big problem. So you can imagine, it is not, even though it can be managed, if you don't pick it up early, you don't manage it, you don't go to the right place, later in life, usually it's been said that for some women, fourth decade of their life, 40, 50, then they start having some of these cardiovascular challenges. But if you had picked the condition early and managed it, we may have prevented some of these problems. So it's quite important. It's not just about the menses or you getting pregnant, but your own quality of life later in life. When you are supposed to be enjoying life, then you are saddled with cancers and cardiovascular challenges, and it's not the best. Yes.
Wow. Ah, you know, it is not the best. And that is where we're going to end. We will pick up cancers in the coming weeks. But please, one thing is for sure. Just go to the hospital early and you will be seen. We want to say a very big thank you to everyone who has watched us and listened to us. This is the Online Pregnancy School. My name is Dr. Linda Vanutu, and my guest for today is Dr. Benedict Afari, an obstetrician gynecologist. We have looked at PCOS, or polycystic ovarian syndrome. He has used some big words, which we'll tackle in our next videos as we talk about cancers, the endometrium, hyperplasia, and all that. Don't worry, we'll share all those with you in our next video. Doc, thank you so much for your time. We'll meet again as we talk about other things to do with reproduction and fertility. To everyone, bye for now. So we see you in our next video. Bye.